Just let me lift the arm. Just let it drop. Fine. Now we'll shortcut also. He does it beautifully so fast.
Yeah.
We'll get a bit of mental relaxation right along with that. We'll start counting backwards from 100 down to 97. Each time you speak a number, you'll doubly relax. By the time you reach 97, all the numbers will be gone. All right, start counting.
100.
Relax now. Let it go away, doubly away.
99.
Numbers are fading. They're going away. Are they gone? Entirely gone. Fine. Now I'm going to stroke your hand. It's going to become numb. Gradually become numb. We'll take it clear out at first, but we'll gradually let it go out. With a stroke of 3, it'll feel numb. 1, 2, 3. Feel it? Feel how numb it is? Now when you tip your head backwards, I'll have you tip your head backwards, and when you do, it'll feel twice as numb as it does right now. Now tip your head backwards. Now forward. Feel it become numb, more numb.
Now I have to open his eyes. That's the thing that I want you to see, because now, once you open his eyes, you're working in somnambulism with the eyes wide open, and I want you to know how to do that.
In a moment, I'll have you open your eyes, and when you do, it'll feel 5 times as numb as it does right now. Now open your eyes. Feel the numbness come into your hand? Fine.
Well, you can feel that numbness now. All right, if he's got it, he's probably got it compounded to the point where it's already plenty numb. Is that right, Doctor? Yeah. Now, but you notice that he can open his eyes and maintain the state. Open your eyes and see that you're maintaining the state. There we go. All right, now that you know that you can do that, Doctor. All right. Now remove the suggestions and bring them up.
All right, close your eyes. Now all the numbness will go away the minute I snap my fingers. Just close your eyes. In a moment, you'll feel much better than you felt all day. Feel better than you have in a long time. Now open your eyes.
Very nice.
I kept wanting him to tell me to open my eyes so I can go back when I got real good.
Yeah.
All right, Dr. Shipman, I want you to take a deep breath. And just close your eyes. Let your eyes completely relax to the point that they will not work. When you relax them completely to the point that they will not work, test them and see that they will not work. Now, in a moment, we're going to ask you to open your eyes and close them again. And each time we have you do this, we want you to double your relaxation. All right, open your eyes. Close them. Each time you open and close your eyes, just double your relaxation. Open your eyes. Close them.
Now, this is the 3rd visit to Bernheim, and now this is the reason that you wait till now to test, to make sure that the physical relaxation is complete. Because 3 visits to Bernheim, during which you've given 2 post-hypnotic suggestions that he is going to be in a deeper state, although you haven't used those words. You've said you're going to relax more than ever, or you're going to be twice as relaxed, or whatever. By this point, you have him to where he is ready for the test for physical relaxation. And that's why we make the physical relaxation test at this point. Test him and see whether he's got it, Dr. Kitchens.
All right, we're just going to test your arm, see that it's completely relaxed. Now, Doctor, having obtained physical relaxation, we want to obtain mental relaxation. And to do this, we're going to ask you to start counting with 100 backwards. And with each number, we want you to double your relaxation, and you'll notice that these numbers gradually fade and completely disappear.
By the time you reach...
By the time you reach 97.
I wouldn't even let him reach 97. Because I'll tell you, that lengthens the procedure. You see what I mean? Make it 98. And even with him, knowing that he can do it, I'd say 99. By the time you said 99, all the numbers will be good. In other words, tend to shorten the procedure rather than lengthen it. Because you're getting familiar enough with hypnosis now so that you can start to make shortcuts. At practice, we don't have you make shortcuts, but in your offices you can and so on. You've got a good state like this, you can shortcut. You say the first number, the numbers will be gone. And you've saved yourself 15, 20 seconds.
Doctor, by the time you reach 99, you will find that these numbers will be entirely gone. Just start counting out loud.
They're gone already?
100.
Double your relaxation.
Ask them if they're gone. I think they are.
Are they gone?
99.
Just double your relaxation and let those numbers fade away completely now.
98.
See, he's taking your suggestion about 90.
Just double your relaxation. Are they all gone now?
C97.
Now they're gone.
Are they all gone now?
See what I mean? That first power, that first suggestion, there was another thing. Remember that while I said to change your number to 98, he had given the first suggestion, and already you see again the power of the compound. The more we mentioned other numbers, the more set became that first suggestion that he could be able to go down to 97. And if you were to ask him this, without my having made any comments beforehand, he wouldn't know why he couldn't have made him disappear before 97, when he knew darn well he could ordinarily. But that's the power of the compound already. Now, doctor, you've got the mental and physical relaxation. Now, stroke his hand or his jaw or someplace and give him anesthesia. But don't give him too much of it at the start so that you can see the power of the compound. Like I did with you, I didn't want too much to come in at first.
Right now, doctor, we're going to produce anesthesia over these 4 fingers. You'll just begin to feel them get a little numb now. And when we have you open your eyes, you'll notice that there is some loss of feeling in those 4 fingers.
Now wait, here would be your first compound. Now this is something for you to remember. This holds true in hypnosis as in everything else. Nothing times nothing is nothing. 100 times nothing is nothing. If you compound nothing, you have nothing. Make sure that the numbness has just started. In other words, how's that hand feel? And he says there's a little bit of numbness. Then you start compounding, but don't start compounding when he has nothing. Because you compound, and I'll bet our old students can verify this, they started compounding when there's nothing there to begin with, and there's nothing there when they finish. And yet if there'd been something there when they started, they'd have had terrific results when they finished. So make sure that some degree of numbness or anesthesia is there before you start compounding. All right, ask him how's the hand.
Doctor, how's the hand?
I can't feel any change.
All right. I would make the suggestion again and just say that these part of your hand will start getting numb.
All right, doctor, over this portion of your hand that we're rubbing here, you'll just begin to feel some numbness in the area. How's your hand?
I can feel something.
Now when you compound, you got something. See what I mean? This is awfully important for you to remember. If you just figure that in hypnosis, nothing times nothing is nothing, be sure you've got something to compound, because if you haven't got anything to compound, you're not compounding anything. Now when you have him open his eyes, suggest that the anesthesia will be a lot stronger when he opens his eyes.
Right now, doctor, as you open your eyes, you'll notice...
No. In a moment when I have you open your eyes. But if you open your eyes, those eyes are apt to pop open right away. You don't want that. So in a moment I'm going to have you open your eyes, and when you do, that anesthesia, you see what I mean? Give it as a post-hypnotic.
All right,
This
Doc.
gives us a nice degree of relaxation.
Now, in a moment when we have you open your eyes, you'll notice that this numbness will increase greatly. Right now you can open your eyes. Just open your eyes.
Boy, did he have a nice degree of nice state, huh? How's your hand? You can open your eyes now. How's your hand?
Feels numb.
You probably don't have to compound it anymore. You probably compounded to the place where he's got perfect numbness. You could probably do deep surgery on it. I bet that's the deepest you've ever been. Is that right? Huh? You went plenty deep, huh? Okay. All right, doctor. Do you want to make it? No, don't. Bring him out of it. Remove the anesthesia. You make a test if you want to, but you don't have to make a test. You know you got it.
We have to on that.
No. All right. Now tell him when you have him open his eyes, make him feel better. He's felt all day and all week, and the anesthesia. Remove the anesthesia.
Right now, doctor, when we have you open your eyes, the anesthesia will be entirely gone here. You'll feel perfectly fine, better than you felt all week. Now open your eyes.
All right, you can open them.
Just open your eyes.
All right, you can keep them open now.
Fine, do I have to get up?
Now that is what I mean. You see, when you accept the subject as beautifully as Dr. Shipman does, because he's done some nice work with it. He's been a student just like the rest of you for about 5 weeks. This is the 5th session. But he's already done some very nice work with waking hypnosis and the trance state. All right, suppose you come on up. All right, look, close your eyes. I'll give you back your memory because you probably just can't amnesia for. All right, close your eyes for a second. All right, when I have you open your eyes, you're going to remember every word that was used on you, and you'll be able to use it very well on everybody from now on. All right, open your eyes. Okay.
I'd like to have you take a real deep breath and just relax yourself. It's a real deep one. Turn yourself loose as you let your breath out. Now let your eyes close. Relax those eye muscles to the point where you know that they just simply will not work. And when you're sure that those eyes will no longer work, I want you to try it. Make sure that they don't work. That's fine. Let that feeling of relaxation go clear on down to your toes. That's fine. Now in a moment, I want you to open your eyes, and then as you close them, you'll double your relaxation. Just let it go clear on through your body. Go ahead, open your eyes now. And close. Let that relaxation go clear on through your body. Now in a moment, again, I'd like to have you open your eyes, and you'll find that you will be 10 times more relaxed than you are even at this moment. Go ahead and open your eyes and close them. Let that feeling go clear on down to your toes. That's fine. Now when you are completely relaxed as you are, I can raise your hand and you'll feel just like a wet dishcloth. Go ahead and make that test on you. This arm. That's fine. That's a beautiful physical relaxation. Now we want to try to attain the same degree of mental relaxation that you already have in the physical way. In order to do that, I want you to count backwards, starting with 100. Then with each number that you bring forth, you will find that you will double the relaxation that you already have, and that by the time you reach 98, the numbers will have completely vanished. Go ahead and start counting. 100, and double your relaxation. The numbers are fading away. 99, double your relaxation again. Find the numbers are gone. The numbers completely gone.
That's fine.
Now,
That's fine.
I'm going to stroke your hand here, and you will find a feeling of numbness in your hand. It will not be complete. Now,
You know, I think this is the only course in the world where we say don't let it be complete and things like that. Because, think of it. Everybody else is trying to induce anesthesia while we're trying to say, now look, don't let it come on yet. You know what I mean? Which I think is a nice attitude to have. All right,
Do you feel that numbness yet?
Yes, it is slightly numb.
Now you will find as you open your eyes that numbness will be a complete anesthesia there in your hand. Go ahead, open your eyes. Now, how does your hand feel?
Very numb.
Very numb. Now, doctor, give it a couple of more compounds till the father can actually feel each surge, you know?
Now, I want you to tip your head backward, and then as you bring it forward again, you will find that the numbness will increase even more. Now, do you feel that surge?
Mm-hmm. All right, if he could feel it, he's a fast learner. That's okay. He knows. You've got it now, haven't you, Father?
Pretty sure.
Okay. All right.
Go ahead and remove that numbness from your hand. I'll just stroke it here. Numbness will completely vanish. Feel better than you felt all day.
Now, I'd be sure to have him close his eyes for it.
Now.
Oh, yes, I would do it.
Is it gone?
No, it's still there.
Right, close your eyes then. I'll stroke your hand again. The numbness will be completely gone when you open your eyes. Go ahead and open your eyes.
Oh, give him health suggestions, doctor. Don't spoil a 100% performance by not giving health suggestions. Close your eyes again, Father. No, you didn't give him health suggestions. So that he opens his eyes feeling wonderful and all that sort of thing, like we did for you.
Like I did just a minute before when I should have had his eyes closed.
All right.
Feel better than you felt all day long. Now open your eyes. How do you feel?
Very good. All right, doctor, would you come up here? Would you work on him? Now, compound for a dental anesthesia, doctor, because it works the same way on a dental anesthesia as it does on a... If he's got to have some work there, did you say you have to do...
No, you have to take him out.
You have to have him taken?
No, I would. You want to do anything.
Oh, well, he doesn't have to do anything. The main thing, I want him to feel the compound, and I want you to feel it. And then you'll see what I mean. All right, doctor.
Can I ask a question here? Right?
No, if it's on the subject.
Compounding, I noticed you achieved it in various manners there. I mean, such as, opening and closing the eyes numerous times, each time getting deeper, and then the head back. And then what about this, like you mentioned?
Oh, that's not for the doctor's office. That's strictly show business. That's strictly show business technique, and I wouldn't want you to do that in your office.
I mean any technique along that line.
Any technique will work. It doesn't have to be pulling of the tie. It can be anything. You see what I mean? Okay, doctor.
Dr. Moulton, I want you to just become completely relaxed there. Just take a real deep breath. Exhale. Just close your eyes, please. Just let that relaxation just go over your entire body, just like a blanket of relaxation. I want you to relax those eye muscles so thoroughly that you won't be able to open them at all. And when you're sure you can't open them, just try it and you'll find you won't be able to open them at all. I'm going to take a hold of your collar, your sleeve here, and I want you just to be completely relaxed all over here. Just let your hand, just don't help me. That's fine. I want you to leave that relaxation, just go all the way down to your toes there. Now, in just a moment, when I tell you, I'm going to have you open your eyes again and close them again, and when you do, by this feeling of relaxation will just go entirely, all the more so, about 10 times as much over your entire body. Now, open again, close your eyes again. This time, this feeling of relaxation will go 10 times as deep as it was before. Now, again, I'm going to have you open your eyes and close them again when I tell you to. And again, you'll find that this relaxation will even become 10 times greater than it was the last time. Just open your eyes again. Close them again, please. Now that relaxation is just going to be so deep that you're just going to be like a blanket of relaxation all over your body. I'm going to take and give you a little anesthesia here on your jaw.
Oh, you're going to get the mental relaxation.
Yes. Now we've got complete physical relaxation. We want to get complete mental relaxation, doctor. So I want you, when I tell you to start counting out loud from 100 backward. By the time you get to 97, the numbers are just going to completely disappear. Now just gradually, slowly start counting out loud from 100, and those numbers are just going to gradually disappear.
100. 99.
Give him some encouragement, Doctor.
You're doing fine. Now those numbers are just gradually disappearing there.
98.
Now
They're going to completely disappear. There won't be any numbers at all. Are they all gone now? No numbers at all. That's fine. Now we have not only your body completely relaxed, but we have you relaxed mentally also. Now we want to give you a little anesthesia here in the lower jaw on the right side. I'm going to stroke your jaw here 3 times, and this jaw is going to get real numb down here. Here we are. We'll give that just a moment, and this numbness is gradually going to set in there and get more pronounced all the time. You feel it there, Doctor?
On the ankle.
That's fine. Now, this time, I want you to open your eyes again for me when I tell you. And this time you're going to feel the numbness become far greater when I have you open and close your eyes again. Now open your eyes again, please. Close them again, please. The jaw is going to be twice as numb down here as it was the last time. Feel that anesthesia working down there?
On the upper jaw, too.
On the upper jaw, too. That's fine. Now once again, when I tell you, I'm going to have you open your eyes and close them again. And this time, this anesthesia is just going to get so pronounced down there that it'll get up, and your lip will tingle, and you'll feel about twice as numb down there as you did the last time. Now open your eyes again, please. Now close them again, please. Now that numbness is going to get all the more pronounced down there.
Ask him how's the jaw.
You feel the jaw getting more numb now?
A little, my upper lip is tingling.
Your upper lip's tingling too.
All right, now, Doctor, he's got the theory of the compound. I think he can feel that increase each time. Is that right, Dr. Moulton?
Yeah.
All right. So that's enough. You don't have to make any tests because the idea wasn't of tests. The idea is of teaching you the theory of the compound. So you know that you've got it now. All right, now remove the anesthesia, bring him out of it, and let him get it on the next man.
Just keep your eyes closed a minute there, Doctor, in just a moment now. I'm going to snap my fingers, and when I do, I want you to open your eyes, and when you do, this numbness is going to be completely gone out of your jaw, both the lower and the upper. Your mouth is going to feel just wonderful, and you'll feel just like you always have. How do you feel there? Feel any numbness at all?
Good. Very nicely done, Doctor. Now you've got the idea of it. Okay. All right, that's why I asked you when I saw you out there in front how the fellows are doing in Peoria with the compounding, because usually after this 5th session they just sing, you know, they come up like that. That's when the good work starts to be done in hypnosis, when they learn this lesson.
What about the term numbness and anesthetic? I noticed you use both of them at various times. I've been wanting to ask you that anyway.
Well, to me, and most people, anesthesia does represent a numbness when it's in the jaw. But I know that when it's in my hands, I don't know what numbness of the hands feels.
Yeah, but I mean, according to tests we ran there, I know a couple of times the person actually had anesthesia, but apparently they had no numbness, at least to their knowledge. Now,
that's right.
If you told them that they were going to feel numbness and then they didn't feel numbness, wouldn't you maybe
tweak in your case? Yes, you would. Yes,
so is it better to stay away from the word?
You mean stay away from numbness?
I
don't know, Doctor. I wish I could tell you. That's a medical problem that I don't know what your semantics would be inside the office and what would be best for the most patients. But I would say in most cases you should have a very easy time once you've learned how to compound. I would say that your results will be good either way, whether you do or whether you don't. If you're compounding, I don't think it makes a lot of difference in that particular case, which word you use, because they'll feel the difference.
Well, actually, I compounded with the eyes closed, too. I mean, opening and closing them.
Yes, but
Now, what if I
compound
left
with
the
the
eyes open and compounded in a different manner?
Well, why don't you try it? Close your eyes again, doctor. Let's put the anesthesia right back there. Stroke the jaw and tell them it'll be just as numb as it was before, and it will be instantly.
Now, just relax completely, doctor. And I'm going to stroke your jaw again 3 times again, and this numbness is going to come right back in this lower jaw here again. It's going to be just as pronounced as it was before there.
Now I'll do it with his eyes open. Now, just a moment, I'm going to have you open your eyes, and when you do, the numbness will get 10 times stronger. Now open your eyes, doctor.
Now open your eyes, doctor, and the numbness is going to get 10 times as strong.
How is it? Feel it. Now keep the eyes open.
Keep the eyes open.
Now compound with the eyes open, and just notice what a surge of anesthesia he gets as you do it.
Now I'm going to stroke your jaw once again, doctor, and this time when I stroke it, why, the numbness is going to get even far greater than it was before. You feel that?
Coming in now.
Yeah. See what I mean? You compound with the eyes open, you get a wonderful effect. Yeah, a lot of people like to compound. Once they've opened the eyes, they like to close them again and compound with the eyes closed. But I always find my best results seem to come when the eyes are open, because that's when the suggestions compound so beautifully. So I wouldn't worry about it. I'd try it with the eyes open for a while. But when you go to actually work on them, you've got to decide whether or not the sight of the instruments will put the critical factor back in focus. You know, sometimes it might be wise to have them close their eyes or look elsewhere or something while you're working. All right, doctor. Now remove the anesthesia.
Oh, yeah. Let's remove the anesthesia here. Now, doctor, I'm going to stroke your jaw here once, and when I do, this numbness is going to completely disappear, and your jaw is going to just feel fine again. Now, feel it going out?
Going.
Okay. All right, doctor. Will you take the next one? Who is seated next there? What? Come on, doctor. Come on.
Get in my hand. Okay. Just take a deep breath. Close your eyes. Just relax. Let your prayer on down from the top of your head, down to your toes. Let the eyelids relax to the point that they just won't open. If you let them won't open, test them. You'll find that they won't work. I'm going to have you open your eyes in a minute, and you'll feel about 10 times more relaxed than you are now. Open your eyes. Close them. That feeling will clear on down. Relax more than ever. If you open your eyes once more now, you're going to be relaxed more than ever. This time too, open your eyes. And close them. I got you. I got you relaxed physically, Charles. I want you to relax mentally. So I want you to start with the numbers 100 and count backwards, and by the time you get to 97 or 98, they'll be completely gone. Start counting. We gone? Okay.
Now, where do you want to put the anesthesia, doctor? Put it on his hand.
Yeah.
Put it anywhere.
I'm going to stroke your hand 3 times, Charleston. The back of it is going to be just anesthetized. Be real numb. Feel that? Is it numb? The numbness coming in? Okay. I'm going to have you open your eyes. And when you do that, that numbness is going to come in there a lot more.
No, wait. Look, give him something to aim at 10 times stronger.
Be 10
He's
times
there only a
stronger.
little. I'd like him to feel a lot because he should.
You feel much numbness in there now? Still. Okay, when I have you open your eyes, that numbness is going to increase 10 times to what it is now. Open your eyes. Feeling numbness? More? Close your eyes now. I'm going to have that numbness increase about 10 times more. I'm going to have you open your eyes again. Open your eyes. Increase. Feel number.
I'll give him some other suggestions besides closing the eyes, because watch a compound with the eyes open and see the difference, Doctor.
I'm going to have your eyes open. Open your eyes now. Have that hand. Can you feel the numbness increasing? Okay, now tip your head back. It's going to increase about 5 times more this time.
What happened?
What happened? Increase any?
Yeah, now you're getting a real effect of it now. See?